Slidell Memorial Hospital. Your hospital for life.
Hello and welcome to another edition of Health Quest, St. Tammany's response to meeting the medical information needs of you, the citizens of our parish. My name is Bruce Clement. I'm the executive producer and host of the show. Today, it's our pleasure to welcome for the first time Dr. Erin Vaughn. Dr. Vaughn is a physician who is board certified in internal medicine and pediatrics. Dr. Vaughn, welcome to the show.
Thank you so much, Bruce.
Tell me now, I looked at your background and I looked at where you went to medical school at a tiny school on the East Coast. I'm only teasing. Yale Medical School. What inspired you after your college careers, or when did you make a decision that medicine was going to be the way that you wanted to go?
Well, I actually had kind of a roundabout way to medicine. I wanted to be a doctor when I was in high school, and then said, oh, I don't know, I just want to help people. I don't have to be a doctor to do that. So I decided to be a social worker, and I got my degree in psychology. But then I was working at a nonprofit, and I was interacting with physicians in the community, and it just kept tugging at my heart that that's really what I wanted to do. And so I actually had to go back to school and get a lot of science courses because I had a Bachelor of Arts, and study for the MCAT on my own. And 2 years after I graduated from college was when I started applying to medical school. So I had a little bit of a gap there, but it was what I knew I wanted to do and needed to do.
You know, it's interesting because when we're that age, when you're that age, you know, you're like, wow, I think I want to do that. I think I want to do this.
Right.
You know, I have a daughter that just graduated from Rhodes College in Memphis. She's a captain of the mock trial team. She had all sorts of accolades, honor graduate, and you know, at that age, you sort of struggle about, you know, what is it I really want to do? So,
Absolutely.
and I basically told her, it's like, I don't care what you do. You know, you go to graduate school, go to law school, go anywhere you want to go, Meredith. Just, you know, just be happy. Just that's the most important thing. So you made a decision, and you made a commitment, and you were persistent, weren't you, about getting into that medical school?
Yes.
Congratulations on that. And now Dr. Vaughn is practicing with the SMH Physicians Network, and they are going through a major renovation at their offices at 901 Gauze Boulevard. And we think they're, you know, as the practices continue to grow, the pediatric footprint is going to remain at the 1001 Florida Avenue. So you can see Dr. Vaughn at the pediatric clinic. Ultimately, will be converted to the pediatric clinic. And then she'll also be practicing internal medicine at 901 Gauze Boulevard in Slidell.
That's right.
So I heard recently a friend of ours, grandchild, came down with meningitis. And it's a topic that has come up in the lay press. It's something that you hear about. And I just felt that it is so devastating, and it is so important to be immunized, that we could gain a lot from your take on this, your knowledge on this. And so we wanted to talk today about the importance of the meningitis vaccination. So in your practice now, have you seen meningitis in your studies?
Well, fortunately, we don't see meningitis near as often as we used to because of the vaccinations that we give. Of course, people most commonly think about what we call the meningitis vaccine or meningococcal meningitis vaccine, but that's only one bacteria that can cause devastating meningitis, and we vaccinate against other bacteria in babies, such as Haemophilus, that can also cause meningitis. So we don't see meningitis near as much as we used to. However, I definitely have seen some cases, thankfully more so when I was working in the hospital, you know, kids that would come in very sick to the ER. And we also still see cases of viral meningitis for which we don't have vaccines for the viruses that cause meningitis, but thankfully viral meningitis is much less severe and less life-threatening than bacterial meningitis.
Right, so one of our goals today is to remind parents and to remind the community of the importance, because it is contagious.
Yes.
Right? It's
Yes.
pretty severely contagious.
Absolutely.
It goes back, if we look at the history, we go back to the 1800s in Geneva, and the first outbreak was sort of defined then. What do you have to say about that particular historical event?
Not much. Not much. I do know that that's the first recorded outbreak of what they had described as meningitis. Of course, at that time, it was not known what was causing this, but they could definitely describe that all of these people had similar symptoms.
Right.
And it was not until 1887 that it was linked to a bacterial infection, and of course not until microscopes were used more commonly that it was people were able to look at the spinal fluid of folks that were sick with what had been described as meningitis, and that was when they started being able to figure out which bacteria were causing severe meningitis.
Yeah, in the research that our pharmacy residents working through Slidell Memorial Hospital's pharmacy residency program, where you have doctors of pharmacy getting advanced training, advanced certification, led by Dr. Keisha Gant, and the clinical pharmacy program led by Dr. Gretchen Blondo. We appreciate the work that they've done, because they've done a lot of research for us on these presentations. We also thank Dr. Ernest Terry with Xavier University, who's doing an ambulatory care symposium for his students that rotate through Xavier University's College of Pharmacy at Slidell Memorial Hospital. So we have a lot of wonderful research help that helps put these together. And I look in 1891 and I see the early analysis, lumbar punctures in 1891. I don't know about you, but that, that's
Amazing.
before CTs.
Right.
You know what I'm saying?
Amazing.
That's kind of scary, huh? Because
Can you imagine being the first person to get a lumbar puncture?
No.
I'm just going to take this tiny needle and insert it where?
Right,
In your back.
right. And I don't exactly
Absolutely.
know where I'm going
Right,
in
right,
with that, huh?
right.
Wow.
And that's still kind of the case. Occasionally they are done under ultrasound guidance, but typically lumbar punctures are done just based on feeling the person's anatomy and finding the right spot.
And that's pretty much is that like the gold standard of diagnostic
Yes.
analysis, a diagnostic tool for?
Yes, for meningitis.
For meningitis.
There can certainly be other signs, of course, the clinical signs, the symptoms that we're going to talk about, and then other things in blood work. But because meningitis is an infection in the central nervous system, that's really where you need to get a sample, ideally, to determine whether or not someone has bacterial meningitis, viral meningitis, or perhaps some other condition.
So we look here and we see in the late 19th century, we see Streptococcus pneumonia, Neisseria meningitis,
Meningitis,
and Haemophilus influenza.
Yes, and as I mentioned, we vaccinate against all three of those now. People, again, tend to associate, because of its name, Neisseria meningitis with bacterial meningitis, but the other two, Streptococcus pneumonia and Haemophilus influenzae, were previously common causes of death, especially in young children, from either bacterial infections in the blood or meningitis. And those are part of our routine vaccination for babies in the first year of life.
So in our next slide, we look at the effects of a meningitis infection on the brain to see what happens. And why don't you take us through this and explain the different steps here that you see?
Right. So, just to clear up, I've already kind of mentioned, but technically when we say meningitis, we're talking about, as it says on the slide, a disease where there is an infection in the central nervous system. So that's going to be the brain, spinal cord, and the tissue that surrounds that, called the meninges. So that is technically what meningitis refers to. Now, different things can cause that infection, different bacteria, and also different viruses. But like I said, most commonly when people say meningitis, they're talking about bacterial meningitis, when there's a bacterial infection of the meninges. And that causes inflammation that's going to affect the spinal cord and also the brain. And that's what leads to the symptoms that people have with meningitis.
So meningitis, infection of the meninges.
Yes.
The meninges are in the brain.
They surround the brain. It's like
They
the
surround the
tissue
brain.
that surrounds the brain and the spinal cord.
So the infection is in the entire spinal column, brain all the way down the spinal column, right?
It can affect that whole area. Like I said, technically in meningitis, the infection is not in the brain and in the spinal cord itself, but it's surrounding all of that. And so that's why it can affect the brain and the spinal cord.
So do you have meninges in the spinal column also? A meninge?
Yes, think of it like a sleeve that surrounds the brain and then surrounds the spinal column as well. So it's a thin membrane, the meninges.
Okay. And the bacteria go in and attack, infect, and ultimately cause serious harm.
Yes. And they can be found in the fluid that also helps cushion and surround the brain and the spinal cord. And so that's why we can do the lumbar puncture to remove a little bit of that fluid and test it for bacteria and viruses.
So you say on the slide here, the slide references life-threatening. You know, that will get people's attention very quickly.
Absolutely.
What type of onset do you see when, you know, when symptoms start to present? It says you said life's threatening. So what kind of timelines? And I know everybody's different.
Sure.
Everything's a little. But what are we looking at here from a time span? Are we talking about days, hours, weeks, months?
Well, with bacterial meningitis, we're really talking about hours to days, from someone feeling fine to being very, very ill. And that's really why meningitis is such a scary disease, because thankfully we do have antibiotics that can treat it even when someone does come down with it. But if you don't know that you're that sick that you need to go to the hospital and get IV antibiotics, then that's when it can be too late for some people. So it is a very quick onset.
So we look at, you mentioned that the bacteria infects the blood, the brain, and the spinal column. Do you see this bacteria, would it be throughout the body also?
Not necessarily. If it's truly just meningitis, then it is contained, like I said, within the meninges. But the same types of bacteria that can cause meningitis can also typically cause bloodstream infection, sometimes also pneumonia, which is an infection in the lungs. So many people that become sick with meningitis may have it in the bloodstream as well, but they may not. It doesn't always infect all the areas of the body.
In addition to the spinal tap, is it customary or typical that blood cultures will be taken?
Absolutely, absolutely. That would change how you would treat the patient a little bit to know if there was a bloodstream infection in addition to a meningitis. And so you're definitely going to do blood tests to check for elevated white blood cell count, some inflammatory markers, and also just markers to make sure that the patient is not, that their organs are not shutting down from being so sick. So you're going to check the kidney function and things like that.
Yeah, so you mentioned that this can come on in a matter of hours and days.
Yes.
So the identification, I'm sure, as you know, being a parent, I'm convinced that when you know, little kids, you know, get sick, and certainly, you know, we all try to treat them, you know, with, you know, different symptomatic type,
right.
you know, the
home
remedies,
like that.
you know, Motrins and Tylenols for fever and that kind of stuff. But what you see here sounds like you're going to have an escalation, a very quick escalation, and so we need to talk about, and we will, about what parents need to look for,
the symptoms,
the
that are more
signs and
specific.
symptoms.
Absolutely.
So let's talk about, you know, how common is it?
So we do unfortunately still see, depends on the statistics that you look at, but between 1,500 and 2,500 cases a year. And that is specifically talking about meningococcal meningitis, about the particular bacteria that we're speaking of today. That is much decreased, like I said, from previous, and fortunately in the United States we don't see meningococcal meningitis as commonly as they do in other parts of the world. Unfortunately, there's still an area in Africa that they call the meningitis belt, where meningococcal disease is much more common. But here we do still see, like I said, 1,000 to 2,000 cases a year.
Right, and so we talk about, you know, the mortality rate. is relatively high with this.
Absolutely. Most other bacterial infections, if you catch it in time and treat it with the proper antibiotics, you're looking at a very high cure rate. But unfortunately, with meningitis, still 10 to 15% of people can die from this, even if they receive the proper treatment. Because sometimes it's hard to get them in time to get that.
Right. And now let's talk about what happens to the survivors, because you mentioned earlier that you begin to, of course, the brain is involved, which that's central control, right?
Right.
But there are other sequelae or other organs in the body that can be equally affected.
Right.
Let's talk about some of those. What it says here, the loss of an arm or a leg. Why in the world would that be associated with meningitis?
Right. Well, like I said, because it is affecting all around the brain and the spinal cord, and we know our brain controls a lot of our body, and then the spinal cord has all the nerves that go out to the rest of the body. Obviously, if you're not getting good blood flow to those parts of the body, then that's how those can be lost. I mean, obviously they can be infected themselves, but it's more commonly just from not getting good blood flow to those areas.
Lack of blood flow as a result of the infection in the brain and the spinal column. And brain damage, obviously.
Right.
Swelling?
Yes. Yes, certainly can be from that and from the infection itself. Like I said, swelling, pressing on the brain. And then if there's infection into the nerves that control hearing, you can also get permanent hearing loss.
Very, very significant collateral damage, so to speak,
right.
from this.
Even of folks that survive.
And the permanent hearing loss. Now, you talked about Africa. There's a meningitis belt in Africa. Obviously, unavailable vaccinations.
Well, not unavailable. There are certainly organizations that are promoting vaccination in those areas and have cut down significantly. If you go to different areas of the world, the type of, and we're going to talk about the different types of vaccines, but the type of vaccine given is going to be different based on the strains that are more prevalent in those areas. And so there are people out there who are fighting to decrease the incidence in Africa as well, but unfortunately it is still more common than it is here.
Fantastic. Let's talk about transmission.
Okay.
How does this go from person to person?
It is, as you say, what we would call person-to-person transmission. So you have to be into close contact with someone. People think about, of course, kissing or drinking after someone, but also even just someone coughing, and you shake their hand and you touch your face, things like that. But we do tend to think about people who are in close contact to where those bodily fluids can come in contact with one another and transmit it. That's why we tend to think about teenagers and college campuses and things like that, military bases. Unfortunately, sometimes you'll see outbreaks, anything where people are in very close contact with each other.
Right. I guess in the old hospital days when they had hospital wards, cross-contamination was very
I'm sure
common.
it was much more of an issue then. We do our best, obviously, when folks are admitted to the hospital now with infectious diseases to keep them separate from other patients.
Yeah. So when you saw this in your study at Yale, there's a particular, those patients are put in some type of isolation, right?
Yes.
To both protect the healthcare workers and
other patients.
And
yes.
to make sure that patient doesn't pick up another infection.
Yes, we would typically go in those rooms wearing gowns, masks, and gloves, like you said, to protect ourselves and also to remove all of that before we move on to another patient.
Because it is highly contagious.
Yes.
All right, and now you talk about infected people may look healthy. How is that? Because you probably feel like dirt.
Well, I think that what they're talking about is the period between when you become infected and when you start to have symptoms. Remember, we said that the acute onset of people getting very ill is from the first symptom. So that can be hours to days, but someone could be infected for more time than that before they start getting sick. So that's really the danger time of transmission, because you could not even know that someone else was sick. And even, unfortunately, if you go into your doctor's office or to the ER before we know that it's meningitis, even though you're starting to get sick, you may potentially be exposing folks before we know what it is.
You're making me want to go buy some masks and
Right.
walk around.
It's a very good reason to avoid the ER unless you need to go, because
Well, yeah. And you know, we've seen pictures of foreign countries and the subway system in Japan. To me, just a very vivid recollection of many people wearing masks because it's so tightly packed and crowded in those very small spaces.
Yes, absolutely.
Not necessarily that common though here.
No, not as many people do that, but sometimes we do require people who are visiting the hospital who are sick at all to wear a mask so that they don't infect anyone else.
Absolutely. Now take us through, if you would, each of the signs and symptoms.
Sure.
The first one, of course, would be
Fever.
fever.
Yeah.
How quick do we see that onset?
All of the symptoms tend to come on, like I said, because it's so quickly, there's not like you have a prolonged time of one symptom and then another symptom and then another. So they tend to all come on fairly close together, all these symptoms that are listed. The problem is a lot of the symptoms are symptoms of any other illness.
Exactly.
So, you know, the ones like fever, headache, being sleepy, and even a rash, those are things that we can commonly see, especially in young children when they're sick, just with any kind of virus, you know, even a cold virus and things like that. The things that are a little bit different that would make us concerned, you know, vomiting, of course, vomiting and fever could be a stomach bug, as we call it, but combined with a headache. When you put all these together is when we start to get more concerned. When it mentions a rash, it really doesn't look like what is in this picture, which just kind of looks like chickenpox, but there's a very particular rash that meningococcal meningitis can cause. It is more distinctive. Now, not everyone is going to have it to give us that clue, and that does tend to come on a little bit later. But it is a rash that is what we call non-blanching, meaning that when you press on it, it doesn't get lighter.
Right.
And so that's something that we would look for as a clue that this is definitely something more serious going on. You know, the other things that aren't as common, could happen, but aren't as common with other infections is going to be what they're saying here, dislike lights, or what we call photophobia, meaning that lights hurt the eyes. Obviously that can happen with other things, but that's less common. Confusion and seizures, of course, not common with other, you know, minor infections and sicknesses. So those are things that obviously you would want to make sure someone got checked out right away. You know, you see that on here, they don't mention neck stiffness. Not everyone describes it, but that's something that we would look for when we're examining the patient, because someone may not realize, oh, I, you know, can't really move my neck around. But as we get inflammation around the the spinal cord in the area of the neck, that decreases the range of motion in the neck. And folks, we're not able to bring the chin all the way to the chest, and that's a sign of meningitis.
Do we primarily see this in the population, in the pediatric population, young adults or adults?
There are two age groups where we most commonly see this. It's going to be in children less than 1, and then in adolescents and young adults.
Okay.
We do see it in older adults and in other folks, but those are the two kind of peaks.
And in our next slide here, we can elaborate on that to talk about who is most at risk.
Right. And as we already touched on talking about the mode of transmission, that is why, as you see here, you know, college students are at a particular risk. They're already in the age group when we tend to see this, and they have a lot of the behaviors that tend to lead to transmission. So that would be obviously, you know, kissing or close contact, living in a dormitory type situation where you have a lot of people, not just one family, but a lot of people living under one roof. Even things like locker rooms is mentioned on here. You know, that's some close contact, folks that are changing clothes, you know, eating, drinking, coughing, sneezing, all of those kind of things.
All right. And so prevention. Now, this is very, very critical. You have an opportunity to protect against everything but the viral meningitis, right?
Well, obviously there are some different bacteria that less commonly can cause meningitis, so we can't ever say we're totally protecting against everything. The meningitis vaccine is one of those that I struggle with the name because I don't want to give the impression that giving the shot is going to protect you from ever getting meningitis ever. More appropriately, it should be called the meningococcal vaccine, but people know it as the meningitis vaccine. But yes, absolutely, the vaccines that we have against the bacteria that can cause bacterial meningitis are the best way for us to be protected. And it's not on this slide, but again, as I mentioned, it's part of our routine vaccines that are given to babies less than 1 to protect against Haemophilus influenza and also Streptococcus pneumoniae, which can cause bloodstream infections and meningitis.
And those are the two primary bacterial infections that you see most commonly associated with meningitis.
Other than meningitis, yes, so those two, and also Neisseria meningitidis that we're talking about when we say the meningitis vaccine. Those are the 3 most common that, especially before we started doing vaccinations, were commonly seen.
Right. So in serogroup B, the age range there is 16 to 23 with certain risk factors. What would those risk factors be?
So yes, so let me quickly talk about the first vaccine. The top one that you see there is actually the one that is most commonly given, is routinely given 2 doses, usually the first one at age 11, and then we'd give a booster at age 16. And it protects against serogroups A, C, W, and Y, as you see there. And those are some of the common ones that we see in the United States, and so that's why that one is given across the board. There was a vaccine that has been developed over the past few years and approved in the United States, which protects against serogroup B, which certainly can cause death and is the primary serogroup that you see overseas, like I said, in Africa. That's causing so many people to die, unfortunately. As of right now, the AAP and the ACIP, who make recommendations about vaccines, have recommended that only certain people need to get the serogroup B vaccine, and that includes people who have any kind of immune system problems, right? So either people that were born with an immune system problem or have acquired one, or take certain medicines that can lower your immune system. Sure. So those folks, we recommend it. Folks with sickle cell disease, folks that don't have a spleen, all of those people need to get it. And in addition, we are seeing outbreaks, as you mentioned, unfortunately, in certain areas. There are about 5 colleges right now in the Boston area that are having meningitis B vaccine, meningitis B outbreaks. And so it's recommended for any college students that are going to be going to those areas to definitely make sure and get the meningitis B vaccine.
Well, Dr. Vaughn, we want to thank you for sharing your very vast knowledge on meningitis with us this morning and encouraging all parents to make sure that their children are vaccinated. And for more information, you may contact Dr. Vaughn at 985-280-8790. She's with the SMH Physicians Network. Dr. Vaughn, from all of us at HealthQuest, we thank you for spending time with us today. Have a healthy day.